Thank you everyone for joining. I think we can open the event now. Your Excellencies, dear colleagues, and distinguished ladies and gentlemen, welcome to the launch of the EU Southeast Asia Health Pandemic Response and Preparedness Program in Malaysia. My name is George Novakovic, and I work at the WHO Representative Office in Malaysia, and today I will be your host. Before we begin, I would like to thank the delegation of the European Union to Malaysia and the Ministry of Health Malaysia for jointly organizing this important event with WHO. If you allow, I will briefly introduce this evening's program and our participants. We will begin the event with a virtual group photo, followed by the addresses from today's key speakers. We are joined by His Excellency Mr. Michalis Rokas, Ambassador of the European Union to Malaysia, Honorable Dato Sri Dr. Adham bin Baba, Minister of Health Malaysia, and Dr. Ying-Ru Jacqueline, WHO Representative to Malaysia, Brunei Darussalam and Singapore. Following the addresses of our key speakers, we will have the opportunity to see a brief overview of the program and its activities, delivered by our WHO colleague, Dr. Paul So, after which we will move to the final part of the event, and I will open the floor for questions and answers session. I would like to thank also everyone who has registered and submitted questions in advance for our key speakers, and we will be also accepting questions during the discussion. So you may leave your questions in the Q&A box. We will do our best to address as many as we can of these questions and as time allows. For the sake of also time and efficacy, please do submit your questions in English language. So let us first take a group photo, and I would ask you all to put on your cameras and your smiles so we can take a group photo before we start the event. Also, that goes for other panelists as well. So please put your cameras on. And I will take the photo in 3, 2, 1. Here we go. One more, just a second. There we go. Thank you. Thank you, everyone. With that, I would like to give the floor to His Excellency Ambassador Michalis Rokas for his keynote speech. Over to you, Ambassador.
Thank you very much, Dato Sri Dr. Adham bin Baba, Minister of Health of Malaysia, Dr. Ying-Ru, Excellencies and Development Partners, distinguished speakers, and of course, all of those who are joining us virtually, a warm welcome. We are here to hail the launching of the EU Southeast Asia Health Pandemic Response and Preparedness Program in Malaysia, a token of the strong partnership between the European Union, Malaysia, and the WHO. The consequences of the COVID-19 pandemic are well beyond the emergency health crisis and humanitarian needs. They translate to long-term structural, social, and economic impacts. Since the beginning of the health crisis, the European Union spared no effort internally and globally to address the dire consequences of the pandemic. It put in place what we call a Team Euro approach, combining and maximizing resources from the EU, its member states and financial institutions, European financial institutions, to support our citizens, but also our partner countries. We led the multilateral response to ensure early access to vaccines, diagnostics, and treatments everywhere. Team Europe is a lead contributor with close to 3 billion euros, which translates to 15 billion ringgit, for the COVID-19 vaccines global access COVAX facility to help secure at least 1.8 billion doses for 92 low and lower middle income countries. Almost 100 million doses have already been delivered by COVAX to 129 countries, including ASEAN member states, Cambodia, Philippines, Laos, PDR, and Indonesia. A few words to the Team Europe's key support to ASEAN in the fight against this pandemic. Team Europe has already taken a series of concrete and quick actions to support our partner countries in the ASEAN region. Per total, Team Europe has provided over 800 million euros, so 4 billion ringgit, to assist ASEAN in its response to the coronavirus. The support is given to health facilities and health workers, provisions of personal protective equipment and sanitizers, as well as technical assistance and institutional support. This includes the new European Union WHO regional program in response to the pandemic, the project that we are launching today. Few examples about this collaboration. In December 2020, Germany, an EU member state, contributed 5 million euros to the ASEAN COVID Response Fund. The contribution will help to enhance ASEAN's joint capacity in response to medical emergencies and future epidemic threats. In May, last month of 2021, and at the second EU-ASEAN expert dialogue on COVID-19 vaccines, the EU experts and ASEAN discussed the emergence of the new COVID-19 variants. Both parties share a common interest in pursuing a multilateral approach to an affordable, fair, and equitable access to safe and effective COVID-19 vaccines that they will cover those variants as well. So let me say a few words about the EU-WHO partnerships and what it means for Malaysia. As part of the Team Europe's global response to the pandemic, the European Union is providing 20 million euros, which means 100 million ringgit, for this new program. The project will support the preparedness and response capacities of our partners in ASEAN. And out of this program, about 1.7 million euros, so close to 9 million ringgit, will directly benefit the citizens of Malaysia. The significant program is implemented by the European Union's global health partner, the WHO, the World Health Organization. And I am sure Dr. Ying will explain the details of that, but it will work very closely with the national authorities, of course, the ministry and the minister, and the ASEAN Secretariat, in order to enhance the regional coordination of the COVID-19 response and strengthen the capacity of health systems in Southeast Asia, while paying special and particular attention to vulnerable populations. The program has a duration of 3 years. The WHO will work closely with the Ministry of Health of Malaysia, as I said, for all related activities, of course, with the European Union delegation. The joint intervention will enhance Malaysia's surveillance and testing system, support timely and transparent communication about the pandemic, promote the vaccine rollout campaign, and strengthen of essential health services. Therefore, and before I conclude, I am very honored to have the Minister, the Honorable Minister, Dato Sri Dr. Adham bin Baba, with us, and I know how busy your schedule is today, Minister, to share us the lessons learned and new opportunities from the National COVID-19 Response and Recovery Plan for Malaysia. And of course, we will hear more from Dr. Ying-Ru on global solidarity for localized COVID-19 response support to government and the Ministry of Health in Malaysia. With this, I mean, it is all of us, and we know very well the coronavirus pandemic continues to impact us and our partners, our citizens, and our economies. The European Union and the WHO remain committed to work closely with the Minister and the Ministry of Health and our other partners to control and suppress the COVID-19 transmission in Malaysia. Therefore, I'm very proud that the Team Europe can contribute and be part of this endeavor. Thank you very much, Terima kasih.
Thank you, Ambassador. And it was really great to hear about both the magnitude and the scope of the EU's support to ASEAN and other countries as well. With that, I would like to give the floor to the Minister. Dato Sri Dr. Adham bin Baba, please. The floor is yours. Over to you.
Thank you, Moderator. His Excellency Michalis Rokas, Ambassador of the European Union to Malaysia, Dr. Ying-Ru, WHO representative to Malaysia, Brunei, and Singapore, Dato Shafiq Abdullah, Secretary General, Ministry of Health, Dr. Hisham Shah, Deputy Director General, Ministry of Health, media representative, distinguished guests, ladies and gentlemen. Allow me to begin by thanking Your Excellency for the warm opening remark. It is indeed my pleasure to be with you today for the launch of the EU-ASEAN program to support the COVID-19 response in Malaysia. On behalf of Ministry of Health Malaysia, I would like to congratulate the organizing secretariat for the endless effort in ensuring the success of today's event. Over the next few minutes, allow me to share with you briefly on the lesson learned, new opportunities in light of this pandemic, and our recently announced National Recovery Plan. Malaysia has been steadfast with the whole of government, whole of society approach in managing the pandemic. The National Security Council and the Ministry of Health Malaysia are working tirelessly to execute the 5-point strategic plan to break the chain of transmission of COVID-19, reduce morbidity and deaths, strengthen diagnostic and surveillance, achieve herd immunity, and increase awareness of the culture of new normal. Despite the challenges faced, the pandemic has demonstrated that good leadership and strategic planning at different levels of the organization are crucial. Factors that can leverage on having some foresight, even during such challenging time, include previous experience and rapid synthesis of current evidence, which facilitates quick response to arising issues. Ability to predict the future based on data will add the value for projection of hospital facility preparedness to the pandemic. Coordination across and between multiple levels, from central to state to district, as well as from the field to primary care to hospital, are essential in the implementation of strategies that were planned. Undoubtedly, leadership and teamwork were the crux throughout the response for COVID-19. Other hurdle that need swift addressing is the spread of false information or news through social media, which triggered a panic among general public and concern among healthcare workers. Hence, designated teams were tasked to address such fake news, providing the target population with means to access verified information. Malaysia has leveraged on strategic and transparent communication across multiple levels to counteract disinformation that undermine policy response to obtain the trust and confidence of her people. Since the inception of COVID-19 in Malaysia till today, effective data management, collecting, verifying, analyzing, and reporting various statistics on a daily basis have been a massive challenge. Frequent engagement and discussion session between data manager and clinician enable them to build a good rapport among them and help to alleviate this challenging situation. As part of the response to COVID-19, various health sector capacities were mobilized to deliver equitable, safe, and effective healthcare services, which includes medicines, medical equipment, and consumable. Hence, finding the balance between the demand and the availability of resources was not an easy task, however. The pandemic has taught a valuable lesson on this. The experience of handling medical equipment procurement through a pandemic provided immediate hands-on experience on the intricacies of fulfilling healthcare demand and need service within the scarcity of resources. Ultimately, the pandemic had shown the importance of people empowerment to share the responsibilities in responding to the pandemic. We have learned that community engagement, motivating participation in activities from merely staying at home and strictly adhering to standard operating procedures to volunteering work in helping others in need assures us the success of our national control measure against COVID-19. As the pandemic progress and response activity continue, sustainability of the effort toward adoption of new norms is of concern in view of the pandemic fatigue leading to motivation of the public, which would wane over time. Realizing that the most important role lies within her people, Malaysia regards all her people as the frontliners, taking care of each other, but adhering to the new norms. Aside from that, the pandemic has been a driver for digitalization and innovation in healthcare for Malaysia. This includes the wider use of technology from contact tracing and digital vaccination certificate on handheld mobile devices, blockchain for vaccination management system, to the use of artificial intelligence in identifying hotspots for outbreaks of disease. Malaysia commenced the nationwide immunization program in February 2021. Since then, we have successfully inoculated 4.3 million of our population, which completed first dose. We have been efficient in vaccinating almost all frontliners, but also the elderly, with more than 50% of those aged above 60 have already received at least one dose. As we expedite the vaccination rates and adhere to the existing public health measure, we are hopeful to flatten the epidemic curve. Furthermore, this will allow us to move forward to comprehensively implement our exit strategy. The government of Malaysia has developed various policies to cater to the welfare of the community. It has always been a challenge to balance saving life and protecting the livelihood of our people. On the 15th of June 2021, the Honorable Prime Minister announced that the National Recovery Plan is set to be in motion. The four-phase plan is designed based on three indicators. First, number of daily COVID-19 transmission among the community. Second, capability of public healthcare system based on the bed utilization rates in intensive care units, wards. And third, percentage of population who have completed 2 doses of vaccine. The first phase of the plan involves the implementation of the full movement control order, and we hope for the reduction in average daily cases below 4,000. ICU beds returning to moderate level, and 10% of population has received 2 doses of COVID-19 vaccine. Once accomplished, the identified targets in the first phase, we will subsequently move to the second phase with reopening of economic activities while having a tight control of movement restriction and social activities. In phase 3, the government plans to allow all economic activities except for those with high risk of COVID-19 transmission. Large gathering will be allowed to resume if there is a decrease of daily cases and once 40% of the population has received 2 doses of vaccine by August 2021. For the final phase, the government intended to resume daily activities with the inclusion of interstate travel and domestic tourism with strict compliance to SOP. During this phase, we can expect a decline in average daily cases to below 500. ICU usage to be at the sufficient level, and an incline in the percentage of the population would be completed 2 doses to 60% by October 2021. Achieving the target of each phase will bring us closer to our ultimate goal to achieve herd immunity against COVID-19. While we have laid out the policies nationally to take care of our people, good and effective partnership is an utmost value during this pandemic. In late 2019, the Joint External Evaluation of International Health Regulation Core Capacities reviewed Malaysia health security capacity. Malaysia has demonstrated a high level of achievement in fulfilling IHR requirements and has a well-developed health security system. However, health security threats can be increasingly complex and ever challenging. This evaluation had identified the gaps and the prioritization of needs and opportunities to enhance the country capacity to prevent, detect, and rapidly respond to public health emergencies, and further fortify Malaysia health security and multi-sectoral preparedness and response capacity for health emergency. Therefore, to embark on this illustrious partnership with EU, ASEAN, WHO is timely and more significant in a time of crisis. It enables us to forge alliance, to promote multilateralism, and to share common interests and values to strengthen both region preparedness for and capacity to respond to current and future public health emergencies. We are most grateful to the UE ASEAN for your monetary contribution and generously that will spearhead this project. It will most definitely benefit the collaborative work of MOH with our partners from other ministries and non-governmental organizations. This crisis underlines the importance of global solidarity and international cooperation. and we would like to acknowledge WHO for this given opportunity and for coordinating the progress and future implementation of this project. As ingenious ideas would give birth to innovation that support the growth and progress of the nation. Ministry of Health, Malaysia is happy to cooperate in research and development areas that aims to strengthen overall emergencies preparedness and health system capacity with specific focus to COVID-19 management and response. Ultimately, we are all fighting against the same enemy, and with solidarity and good regional cooperation, we will win this battle, inshallah. Terima kasih. With that note, I thank you.
Thank you very much, Honorable Minister Dato Sri Dr. Adham bin Baba. And now we will hear from our final key speaker, Dr. Ying-Ru, WHO representative to Malaysia, Brunei Darussalam and Singapore. Over to you, Dr. Ying.
Thank you, Georgia. His Excellency, Mr. Michalis, Rokas, Ambassador of the European Union to Malaysia, Dato Sri Dr. Adham bin Baba, Minister of Health, Malaysia, Dr. Shafiq Abdullah, Secretary General, Ministry of Health, and Dr. Hisham Shah, Deputy Director General, Technical Support. Your Excellencies, dear colleagues, representatives of media, distinguished ladies and gentlemen, I'm pleased to welcome you today for the official launch of the EU Southeast Asia Health Pandemic Response and Preparedness Program in Malaysia. I would like to extend my gratitude to the delegation of the European Union to Malaysia and Team Europe and the Ministry of Health for embarking on this collaboration. Today, we celebrate a significant partnership, one that spans countries and regions and highlights the critical importance of collaboration and solidarity as we fight this pandemic and its long-term implications. Over the course of the last year and a half, COVID-19 has brought to light gaps and inequities, as well as the strengths and weaknesses of national health systems and international collaboration and international regulations for emergency preparedness and response. We've learned that no single government or no single international agency can address this pandemic alone, and that we can only achieve results when we work in a true multilateral fashion. The European Union is one of WHO's major partners, particularly in health systems and emergency preparedness and response. And now this partnership has expanded to include several ASEAN countries, as mentioned before, including Malaysia. WHO and health authorities in Malaysia have a long-standing collaboration. We have been working closely together for decades, preceding the onset of COVID-19. This collaboration now will only grow stronger as we work together to overcome the current crisis and ensure that WHO, the EU, and local partners are aligned in their efforts to support the outbreak response. And we still have a long way to go. Malaysia has worked diligently over the past years to build its capacities in emergency preparedness and response. This has played a critical role in responding to COVID-19, but we have seen that even the strongest of health systems in several countries around the world can be pushed to their limits, and Malaysia is no exception. In line with WHO's Global Strategic Preparedness and Response Plan and guided by the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergency, we also call it UPSET 3. This program aims to build on the existing preparedness and response foundation established by the government and through working with partners in all sectors, ensure that people in Malaysia have access to essential health services including the most vulnerable, and that healthcare service delivery continues amidst COVID-19. This inclusive and proactive program has been carefully tailored with the Ministry of Health to ensure that activities meet the specific needs of the country and tackle common challenges we see in the region, from COVID-19 surveillance, contact tracing, laboratory testing, in particular for variants of concerns, and COVID-19 immunization efforts, among others. The program also reinforces regional collaboration among ASEAN countries, as cross-border cooperation is key to an informed response for this emergency or the next one. It is also important to recognize another partnership that stands out from the very beginning of this pandemic, the one with the media. The media have played a pivotal role in sharing accurate and life-saving information, and we thank you for that. Through the program, we intend to expand this work as we have a shared responsibility, not only to communicate proactively with the public, but also to engage with and protect the most vulnerable in our society. This contribution from the EU is timely, as it supports both the current response, the ongoing national immunization program for COVID-19, and the recovery plan, as per national priorities. The results of the activities planned through the program will benefit Malaysia beyond COVID-19 and truly solidify its ability to build back better and be better prepared for future health emergencies. Malaysia is an important partner for WHO and the EU. So let us continue to work in global solidarity and make this important partnership one of many that we will forge as a team when responding to health emergencies. Thank you. Over to you.
Thank you, Dr. Ying. I would now like to hand things over to Dr. Paul from WHO for a brief overview of the EU Southeast Asia Health Pandemic Response and Preparedness Program in Malaysia. Over to you, Dr. Paul. You may now present your screen. Thank you. Please proceed, Dr. Paul.
Sorry, can you hear me?
Yes, we can. Good.
Sorry for the glitch.
Please go ahead.
All right. The Honorable Minister of Health, His Excellency Ambassador of the European Union to Malaysia, distinguished partners, colleagues and friends. Salam sejahtera and good afternoon. Thank you so much for joining us in this launch event. My name is Dr. Paul, and I will be giving you an overview of the EU Southeast Asia Health Pandemic Response and Preparedness Program in Malaysia. The overall objective or impact of this project is the provision of support to the government to control the COVID-19 pandemic in Malaysia. Specifically, our support aims to strengthen the health emergency preparedness and to augment the health system's capacity using the existing WHO MOH collaborative mechanisms and agreements. The specific objectives or outcomes of this project are that all sectors and communities are mobilized to ensure participation in the prevention, preparedness, and response of COVID-19. Secondly, sporadic cases and clusters are controlled, community transmissions are suppressed, and lastly, mortality of COVID-19 is reduced. The total 3-year budget for Malaysia is 1.724 million euros. This is equivalent to $2.1 million or 8.7 million Malaysian ringgit. For the first year, ending in December 2021, the available budget is 1.152 million euros, which is approximately $1.4 million or 5.8 million Malaysian ringgit. The year one budget constitutes 66.8% of the total available budget of 3 years. The EU Southeast Asia program activities and outcomes are structured along the lines of the COVID-19 Strategic Preparedness and Response Plan, so-called the SPRP. The SPRP outlines the public health measures that need to be taken to support countries to prepare and respond to COVID-19. As you can see on the left of the screen, there are 10 pillars of public health emergency, preparedness and response according to the SPRP. Based on the SPRP, WHO will use the EU contribution to support the government's response to COVID-19 in the following key areas. The first outcome of the project is that all sectors and communities are mobilized to ensure participation in the prevention, preparedness, and response of COVID-19. So in relation to this, WHO and its partners will support the country in the strengthening of the coordination, planning, and monitoring of its COVID-19 response. We will continue to work with the country in the critical role of ensuring coherence and operational alignment throughout all pillars of the response at the national and subnational level through a multi-sectoral and whole of government approach. The second outcome of this project is that sporadic cases, clusters, and community transmissions are controlled. To correlate with this, WHO and its partners aim to support the country in the strengthening of surveillance, risk assessment, and contact tracing mechanisms in Malaysia. We will continue to support health authorities in disease surveillance and strengthening of the public health capacities to identify, isolate, and treat cases, trace and quarantine contacts, and implement and adjust the public health and social measures. These are the backbone of the COVID-19 response and are key to suppress transmission until vaccines are administered on a wider basis to the population. We will also assist the country in strengthening and utilizing the robust COVID-19 surveillance data to calibrate the appropriate public health and social measures for the country. Now, we know that strategic diagnostic laboratory testing is one of the cornerstones of the management of COVID-19 pandemic. Now, in relation to this, WHO and its partners aim to support the country in the strengthening of the national laboratories and testing strategies. We will continue to work with the government to ensure that cost-effective strategies and mechanisms are in place to detect new variants of concerns and variants of interest through appropriate screening and sequencing methods. The next outcome of this project is that community transmission are suppressed. We know that risk communication and community engagement are integral to the success of COVID-19 response and that of other public health emergencies. So in relation to this outcome, WHO and its partners aim to support the country to improve its risk communication and community engagement, better known as RCCE. In this capacity, we will provide ongoing support to the government to ensure that all communities are reached, heard, and represented in the COVID-19 response. This will be accomplished through the provision of data collected via social listening, public sentiment analysis, and development of information, education, and communication materials for the delivery of actionable, timely, and credible health information. The activities under this pillar are also geared to develop the RCCE capacities within the Ministry of Health and broader health workforce. Also, in relation to the same outcome, WHO and its partners will support the country to enhance its COVID-19 vaccine readiness. By applying a multi-sectoral approach, we will continue to support Malaysia with its COVID-19 national immunization program and to respond to challenges of an ever-changing landscape of viral transmission and disease incidents. Special emphasis will be placed on ensuring an inclusive vaccination program that reaches all pockets of society, especially the most vulnerable populations. The last outcome of this project is to reduce COVID-19 mortality by maintaining essential healthcare services and systems. For both the immediate and the long term, we will work with the government to support the country with its health system strengthening, ensuring that essential health services not only continue amidst the COVID-19 pandemic, but to grow stronger and be more resilient for future health emergencies. Throughout the aforementioned goals and activities, WHO and its partners will work with the government to meet enhanced specialized supply chain needs, including for vaccines, test kits, PPEs, and oxygen, through technical and operational support. This includes coordination of multiple channel procurement and distribution through the identification of demand, forecasting, certification, sourcing, and delivery of essential supplies to where they are needed most at national and subnational level through the COVID-19 supply chain system, better known as CSCS. With this, I hereby end my presentation. Thank you for your attention and support.
Thank you, Dr. Paul, for a great presentation. I think with that, we can begin our Q&A session. At this point, I would again like to remind all the participants who have registered that I see some of you are raising hands, but unfortunately an option to verbally participate in the event is not possible, but I urge you to leave your questions or comments in the Q&A section for our key speakers. And again, we will really try to address as many as we can because we have already received quite a number of questions. I will read the questions and delegate them to one of the keynote speakers based on the topic and whom they were directed to. But of course, I invite other speakers and they're welcome to contribute with their response and broaden the discussion if they would like. So let us start with the questions. Number one is directed to the Minister of Health. And then could you please elaborate more on how Ministry of Health Malaysia intends to work together with WHO and EU ASEAN in supporting Malaysia's COVID-19 response and emergency preparedness? Over to you, Honorable Minister.
Thank you. Thank you for the question. Firstly, I would like to mention in my speech earlier, we are truly very grateful for the excellent partnership and for the generosity of European Union for this substantial contribution. As to the implementation mechanism to this partnership, we'll have a country working group to monitor and oversee the utilization of this budget. The country working group will be co-chaired by our Deputy Director General of Health, Dato Dr. Shamshah bin Ibrahim, and also the WHO representative for Malaysia, Brunei Darussalam and Singapore, Dr. Yin. This fund will be extremely helpful to us in our response and emergency preparedness.
Thank you, Minister. And I believe that the next one is also for you. Let me just see. So someone is asking, will the Ministry of Health in Malaysia's healthcare workers be involved in this project, and how? Would this be an additional task in their already busy schedules during the pandemic? I believe this is also for you, Minister.
Yeah, thank you. Yes, indeed, as you rightfully pointed out, our healthcare workers are already working very, very hard in combating COVID-19 at the various healthcare settings. Therefore, to maximize our human resource capacity, we will be working hand in hand with the private sector, community partners, international and United Nations agencies, and NGO to run the project on the ground, which are supported by this EU ASEAN Fund. At this point in time, everyone experiencing fatigue, so we need to gather as much forces as possible for all the fraternities in working together.
Thank you, Minister. The next one we have, I think it's for Dr. Ying. Yes. How will WHO support the government to address vaccine hesitancy among the people in Malaysia? Over to you, Dr. Ying.
Thank you for the question. That's actually a very important question. So we have been already working very closely for a while with the Ministry of Health on gathering data and inputs from communities to understand people's perceptions, fears and concerns related to vaccines through social listening activities, multiple surveys and studies. So that's very important, and there we work closely with well-established non-government organizations in Malaysia. So, and based on the information collected, we are jointly working on developing effective messages, close feedback loops, and support the hesitant population to make informed choices. And these efforts all aim to resolve confusion among communities, answer questions, and provide timely and accurate information and guidance to the public. So also we work together on addressing rumors and misinformation and setting up, we have been setting up a rumors and misinformation alert system. This will be intensified to identify and tackle early on anything that might contribute to confusion and further increase hesitancy. So we're also working and have been working with health authorities at the state and district level. This is actually organized by the Ministry of Health, their health education officers, to train healthcare workers, volunteers, and their officers in the states and districts how to apply risk communication and community engagement principles in their daily work and enhance interpersonal communication skills so they can respond in an empathetic way to people's concerns regarding COVID-19 vaccines. And that's a close collaboration we are also having with UNICEF, one of the other organizations who are supporting these efforts. Thank you.
Thank you, Dr. Ying. The next question, it's for the EU ambassador, Mr. Michalis Rokas. Someone is asking, what is the state of play on vaccines and vaccines sharing by the EU?
Thank you. The European Union has exported half of the vaccines it produced in Europe to other countries in the world, as much, which means as it has delivered to its citizens. I previously in my speech, I explained that we are also the lead contributor with 3 billion euros to the COVAX facility. So I don't want to repeat that, but also what we intend to do is we have pledged, Team Europe has pledged to donate at least 100 million doses by the end of this year of vaccines secured under the EU's advanced purchase agreements especially to low and middle income countries. But of course, larger donations are very welcome and of course possible. Following these pledges, centrally, the European Commission is discussing with the member states the most efficient and simplest modalities to share the vaccines, mainly through COVAX. So these modalities, they take into account the need to achieve vaccination objectives and to accelerate safe and effective vaccination everywhere through dose sharing. So we are going to coordinate this. This is member states' individual decision, which types, the number of doses, the time frame, but definitely we are going to accelerate the donation by the end of this year.
Thank you, Ambassador. And the next one is also around the same topic. We received a question on how many vaccines originating from the EU have by now reached Malaysia.
Well, I have the most recent, yes. So by the 21st of June, 5 million doses have been approved for exportation and 4,087,000 doses have been effectively transported already by 15th of June. These numbers concern doses manufactured by BioNTech Pfizer. And to these exports, we should also add that the EU has manufactured and already shipped 560,000 doses of AstraZeneca through the COVAX scheme. The approval, if you allow me to add, is very fast. It takes 2 or 3 days. And let me also mention that the European Commission has approved all the requests from Malaysia until now.
Thank you very much, Ambassador. The next question is for the Honorable Minister of Health. Can you please elaborate on the challenges faced by Malaysia in managing the pandemic and how this initiative or program may help in addressing the current challenges in Malaysia? Over to you, Minister.
Yeah, thank you very much. In responding to COVID-19, the various sectors' capacities has been mobilized to deliver equitable, safe, and effective healthcare services. One of the challenges that I mentioned earlier was to balance between the demand and the availability of resources. And I'm sure this challenge is not only experienced by Malaysia, but the whole of the world had to address similar challenges. In the spirit of solidarity, we have been giving and receiving support in terms of monetary, medical supply, exchange of information from the local, as well as at the international level via ASEAN and WHO. The support received has been a massive boost to our management, in fact. I believe the abundance of benefits will come out of this collaboration. And again, we are indeed blessed to be given this opportunity.
Minister, we've just received, and just to mention again, because I see still that we are receiving and admitting participants and then media representatives who may be later on joined. So just a notification, one, this event is recorded. So we will be happy to share with media representatives who have come in a later stage to the event, the recording itself. And also, again, feel free to leave your questions in the Q&A box. Now, we've just received one. I believe that we can assign this one to Dr. Paul. And it says, by referring to Dr. Adham's speech earlier, he said that he's most grateful for the EU-Asian contribution, monetary contribution and generosity that will spearhead this project. How much is the contribution? I believe that this is someone who has joined later. So Dr. Paul, would you kindly answer this one as well? Over to you, Paul.
So thank you for your question. As I've presented earlier, the total 3-year budget for Malaysia is 1.724 million euros. This is equivalent to 2.1 million US dollars or 8.7 million Malaysian ringgit. So for the first year, ending December this year, the available budget is 1.152 million euros, which translates to 1.4 million US dollars or 5.8 million Malaysian ringgit. So the year one budget actually constitutes about 66.8% of the total available budget for 3 years. Thank you.
Thank you, Dr. Paul. The next question is for Dr. Ying. What kind of activities are foreseen within the program to support the vaccination of migrants and other vulnerable communities? Over to you, Dr. Ying. Dr. Ying, I believe you're muted.
Yeah, this is a very important question. So we have been working with the Ministry of Health to jointly tackle the issues vulnerable communities, hard to reach communities face, with an assessment of needs and establishment of two-way communication with their communities. And we have been working also together through a mechanism with other UN agencies, with the UNHCR, the UN agency working with refugees, and international organization with migration, IOM, to translate communication materials on request of the National COVID-19 Task Force to multiple languages, with to ensure that these communities have access to healthcare and life-saving public health advice and how to protect themselves against COVID-19. So we are also planning to supporting community outreach campaigns. So discussions are ongoing with several states, and to support mobile vaccination teams to go out, then also delivering trainings to volunteers and working to build vaccine demand, acceptance, and trust among those vulnerable populations. So reaching the unreached is very important for WHO and one of our key priorities. Thank you.
Thank you, Dr. Ying. And I also believe that the next one is for you, and you can answer. What specific activities in the response need to be enhanced in order to prevent another surge in cases such as the one we're seeing now? And this can also go to you or to the Ministry of Health for that matter. So Dr. Ying, if you would start, and then if the Honorable Minister wants to add on, please go ahead.
That's a very difficult question, which is coming. Yeah, so maybe just to say it's individuals, communities, and governments at the national and subnational level all have an important role to play to prevent another surge. It's challenging because of various factors, in particular fatigue, pandemic fatigue. It has been a long time. So the WHO guidance to reduce risk and transmission requires a combination of measures, including ongoing surveillance, early detection, and strengthening contact tracing efforts, along with implementation of a targeted response measures. I think particularly important is the economic sector in Malaysia. And WHO has just updated the third version of its guidance on calibrating public health and social measures, which which look at specific groups, level of risk assessment for type of epidemics, where infections are occurring, and the health system's capacity. And this is very important, actually, to plan for the recovery and to prevent that there would be another surge. Then, of course, the vaccine rollout, and that's the priority of the Ministry of Health of the government, we understand, with this COVID-19 National Task Force, but at the same time also not to lift measures too early. That's what we have seen in some countries like in Asia, who have high COVID-19 vaccine coverage. unfortunately, we are seeing research of infections, although not severe disease, but infections. So it's a complicated issue. But I think it's important to remind everyone to listen to your health authorities and follow their advice, to participate as a responsible citizen in the response. Thank you.
Thank you, Dr. Ying. I leave the floor open with the minister or the EU ambassador would like to add on anything to this question, or we can move to the next one. Okay, let's move then to. Apologies, there is a question for the EU ambassador. Can a Malaysian citizen travel to Europe? How can the EU and WHO support the Malaysian government to develop digital COVID-19 certificates compatible to the EU and WHO specifications and requirements? Over to you, Ambassador.
Thank you. Well, this is an important question on the post-recovery. We have to think about our expats, our entrepreneurs, foreign direct investment, and key sectors of the economy, such as tourism. So, of course, we are looking into that. So, I have to say that we are very happy to cooperate with Malaysia, especially with regard to facilitating travel. And as you know, in the EU, we have developed the digital COVID certificate. As we are ready to collaborate in any other matter. We, of course, we encourage Malaysia as well as every other country to look at our digital certificate. I know that Malaysia has developed its own and through the My Sejahtera, and to consider using it because we have decided in the EU to make publicly available the specifications of this digital certificate, which, by the way, it is very safe because it doesn't store the data. It mentions all what is necessary, the vaccination, the type, if a person has been infected with the COVID, but nobody can download. So it has very enhanced security features. So the European Commission will make available this checklist to all third countries, including Malaysia, that are interested to connect their own application with our own, so to make it compatible. It will, all these technical requirements are there. I'm very pleased to say that at technical level, we already collaborate. So we had already contacts. So these are ongoing. But of course, we are also collaborating with the WHO and ICAO for future travel. I think this is key to our economies, to our societies. I think while we have to keep the national situation in mind and the health emergencies and adapt, we are very ready for that in the basis of reciprocity. So hopefully, when the elements are there, the schemes such as the digital COVID certificate could be an important tool in our hands to reopen travel between Malaysia and EU.
Thank you very much, Ambassador. The next question we have received is directed to the Minister of Health. From the multimedia presentations that we have watched moments ago, we know that one of the objectives of this collaboration is to protect the vulnerable and especially hard to reach populations. Can you elaborate on that? I think this is also the continuation of what Dr. Ying was mentioning before, but Minister, please, the floor is yours.
Sure. We need to address the vulnerable and hard to reach population, as they are our people living here on Malaysia soil. Our principle is leaving no one behind. This is coincide with the fundamental principle of universal health coverage. And that is why I am very delighted with this WHO, EU, Malaysian MOH collaboration. And this fund and the human resource will be very helpful in assisting us to reach out to the peripheries to ensure that this population receive the healthcare services that they need, particularly the vaccination program, and the coverage should be completed, given to them in the time manner. Thank you.
Thank you, Minister. And can I just ask all the other panelists who are not speaking just to mute themselves while key speaker is giving an answer to the questions. There is another one that just came, I think it's also for the ambassador. Can you offer some more details about the EU digital certificate? I believe you already provided some insights, but please, if there's anything else to share about the specific of the EU digital certificate, the media representative is asking.
Okay. The EU, we developed this certificate with the aim to facilitate free movement inside the EU, first and foremost, because you know that we had a lot of issues within our own borders and what we call the Schengen area, but of course, and beyond, because we are thinking of the future, the post-recovery. So the EU digital COVID certificate covers three elements. I have briefly mentioned them: COVID-19 vaccination, test, and recovery if a person was already infected, and also which type of vaccine. It is a tool which would allow, hopefully, the gradual lifting of restrictions and resumption of safe travel ahead of the summer, which is our holiday period, and as such aims to contribute to overall recovery, economic recovery. I have to mention that this digital certificate is not a precondition to travel, like a national passport, but it aims to facilitate travel. That's why we are looking into ICAO and IATA, and of course the WHO, in order to make it as a tool, post-recovery tool for facilitating travel, including globally. So as such, we don't want to see additional travel restrictions that should be imposed to holders of this certificate, meaning thinking about quarantines, all that. So there is where we are. The technical specifications, I am not an expert, but I understand that it has a digitally signed QR code. And as I said, it is safe and secure, because data protection, it is one of the cornerstones of the EU policy. So we want to make sure that when verified, this QR code does not allow for the country that verifies and in the future to store or retain those data. It is only verification, and then all the data protection is ensured. So it's a technical issue, but what I am pleased to say is that very soon the European Commission will make these specifications publicly available, especially for our partner countries like Malaysia, that they want to use these features or be inspired and to facilitate in this way travel in the future.
Thank you, Ambassador. The next question we have received is for WHO representative. How will the program support laboratory capacity for genomic surveillance? Over to you, Dr. Ying.
Yeah, thank you for the interest. We had discussions with the Institute of Medical Research and the Ministry of Health and various academic institutions, and based on a baseline assessment on capacity done for planning the support, WHO will most likely provide reagents for gene sequencing, support training for lab personnel on gene sequencing, and bioinformatics on analyzing the genomic data. And yeah, also we may provide support on the development of sampling protocols and review and work with national standard protocols to ensure quality of testing. So that's still early planning of this work. Yeah.
Thank you, Dr. Ying. We have received only one more question from the media. This one is also for you, Ambassador, but I believe that you have answered some of this in your keynote speech, but they're wondering if you can share now or later the details, breakdown of the vaccines approved to supply Malaysia by the EU. So I think you have mentioned this already, but over to you, Ambassador.
Yes, as I said, I mean, I don't have a full detailed breakdown of all the exports to Malaysia, but what I can share is that because we have this scheme of export authorization, and Malaysians exports to Malaysia, they go through this scheme. So what I want to say is that by 21st of June, so yesterday, 5 million doses have been approved for exportation. And already by the 15th of June, 4,087,000 doses have been effectively exported to the country. These numbers concern doses manufactured by BioNTech Pfizer. And to these exports, we should always add the ones that they were manufactured by the EU, and they concern 560,000 doses of AstraZeneca, but they go through the COVAX scheme, and as such, they are exempted from export authorizations. And I want to reiterate what I said. This is a fast process. It takes 2 to 3 days of approval, and the EU has approved all the requests made from Malaysia until now.
Thank you, Ambassador. With that, I believe that we have answered all the questions that we have received prior to the event and also the ones during today's event. So I would leave the floor then to our key speakers for any final words. Honorable Minister, I would leave the floor to you for any final words, and then, of course, Dr. Ying and the Ambassador can also give their final words. Over to you, Minister.
Thank you very much. Indeed, it's a very interesting and fruitful meeting. Allow me to say that we in Malaysia thanks very much on the support and consistent monitoring on our health system. And as you see, my background is Crisis Preparedness and Response Center, where we operate daily, and we manage it for almost after March last year till now. So we are very grateful that all the support come from your side, and probably we need more assistance coming and solidarity in our effort to combat COVID-19. Thank you very much.
Thank you, Minister. Dr. Ying, and any final words?
Just to again say this, we see this as a partnership, as an opportunity for us. Malaysia is also a host. Our host has provided vaccinations, is providing vaccinations also to us as your guests and partners. So, and we see Malaysia also as an important resource for the region and other ASEAN countries, and an important partner, and a lot of exchange between the countries. So thank you very much, Dato Sri.
And Ambassador Michalis, Rokas, please go ahead.
Yeah, thank you. I also want to thank the Honorable Minister and Dr. Ying-Ru Actually, I retain three words from these debates: solidarity, collaboration, and partnership. We are also very pleased and honored to working here in Malaysia in close collaboration with the minister to overcome together this crisis. So the channels are open. Back at headquarters, there is the will to discuss any matter and come to solutions and work closely with the Malaysian government and the WHO. So whatever issue comes either at this moment or in the future, whether also with opening the borders and the digital certificates. And we are also ready with additional funds if needed, because the timing is very good. We have the new EU programming circle ahead of us. So perhaps we can find also new opportunities as this debate develops for further financing, for further policy dialogue, for further technical expertise, should the Honorable Minister or the WHO ask us. And thank you very much. Terima kasih.
Thank you, ambassadors, and thank you to actually all key speakers for your valuable time and participation and the fruitful discussion. I would also like to thank the participants and the media representatives for their engagement and for sending the questions and making this event more interesting, of course. And to the core team of Ministry of Health and WHO regional office as well, and colleagues from the EU for setting up the event and all the logistic and administrative behind the scenes work that they have done. So with that, I thank you all and I wish you a good rest of the evening, and then we may close the event for today. Thank you again.